Cervical. I'm the Senior Director of Cancer Screening and Chronic Disease Programs at Adagio Health. As the Director of Cancer Screening and Chronic Disease Programs, I oversee the Breast and Cervical Cancer Early Detection Program. The Breast and Cervical Cancer Early Detection Program, otherwise known as BCCEDP for short, offers free breast and cervical cancer screening and diagnostic services to Pennsylvania residents who are ages 21 and over, who make at or below 250% of federal poverty, and those who are uninsured or underinsured. Through the program, we are able to offer services such as breast health education, breast self-exams, a clinical breast exam, as well as mammograms, MRIs, ultrasounds, and biopsies. And on the cervical end, we are able to do HPV screenings as well as pap tests. As well, we can offer and give help with colposcopies, endometrial biopsies, and other diagnostic services for cervical cancer. We have been offering these services for almost 30 years in Pennsylvania. Adagio Health has been the manager of this program in areas of Pennsylvania since its inception in the 90s.
I'm Natalie Kraus, the Clinical Operations Director for Adagio Health. We had a woman who needed some breast follow-up, and she was insured in 2017. And she had kind of had that breast workup where some tests needed follow-up, what have you, and she lost her insurance. So when she finally got a hold of us, she said how many people she called, outpatient centers, diagnostic centers, surgical centers, physicians' offices, to finally stumble upon our organization and to learn about the BCCEDP program. But BCCEDP's so great because it covers people from that initial clinical breast exam, that office visit, through all of the diagnostic testing and up to and including surgery. I told you that patient that was a cashier. I'm proud of the fact that we support people's health so that working people who might not be insured don't have to struggle with a cancer diagnosis alone without care.
As we all know, we're in the middle of a global health pandemic. We also want to relay to all of you today that cancer doesn't stop for anyone or anything. So while it is important to follow all of the orders from public health officials, it's also critical to make sure that we are keeping up with annual well woman exams, as well as getting mammograms based on screening guidelines. If you need help accessing services during this time and in the future, please feel free to give us a call at our 800 number, 1-800-215-7494.